Giving blood is a simple way that everybody can give back. It's about helping to save lives and protect lives. It's about supporting our health system and supporting other Australians. It's a very communal thing to do, and Red Cross is a global icon, and the work that they do supports Australians. And only yesterday at CSL we saw arguably the world's greatest blood products company, which is also manufacturing vaccines, and to see their work in action is to see this blood being utilised for its highest purposes, but also supporting in transfusions. Both Chris Bowen and I are giving blood today. It's very much a bipartisan show of support, and we need 16,000 Australians to give blood who would otherwise not do that over the coming 2 weeks. Through the pandemic, one very interesting thing is that blood donations have remained very high. Our immunisation rates and our blood donation rates have been very high. Just at the moment, they've dropped a little bit, perhaps as people get back to doing those things which they otherwise couldn't do. So if you can give blood in the next 2 weeks, that would be great, particularly A positive and O positive, but all types are welcome. It turns out that mine is A positive, so it's nice to be able to contribute in some small way. And the important news on my personal front is they tell me that blood pressure is 117/76, so we're doing okay. The country is also doing okay, and the country is doing well. I've spoken this morning with the National Incident Centre, with the South Australian Aged Care Response Centre, and the South Australian Minister for Health, Stephen Wade, and last night Professor Paul Kelly, the Acting Chief Medical Officer, and myself also spoke with the South Australian Minister. The advice that we have is that there are 3 additional cases today with regards to the family cluster, but there are no cases of community transmission in South Australia outside of that cluster. We have seen widespread testing, and South Australians have done a great job in presenting for testing, and we'd encourage them to continue to do so. Obviously symptomatic, so if you have signs or symptoms of COVID, whether it's temperature, whether it's flu-like symptoms, whether it's something as simple as a runny nose, now's the time to present. But also asymptomatic testing is being encouraged, and that means that we are looking for each and every person who might have in any way, shape or form been exposed to come forward. Over 4,500 tests reported to midday, our time, in South Australia, but when Stephen Wade or the South Australian Government provide additional information later today, those numbers no doubt will continue to grow. The actions that the Commonwealth have taken, firstly, we've made sure that the 10 GP respiratory clinics across South Australia are set up, running and operating to capacity. They're receiving very good responses from the public, and again I want to thank the South Australian and particularly the Adelaide public for their cooperation. Secondly, we have established the National Incident Centre as a contact tracing extension. We're seeing contact tracing support from other states. And then thirdly, we have established the South Australian Aged Care Response Centre. In particular, the advice that I have, I was briefed shortly before joining you by Professor Brendan Murphy and the South Australian Aged Care Response Centre, which is a joint Commonwealth and SA activity. The Anglicare Brompton facility has 40 residents and 60 staff. It's in the inner north. It has a very important role. It caters for clientele and residents, many of whom have had hard lives. Some have been homeless, some have had addiction challenges, and so it is really serving the neediest. So it's an elderly cohort that has great needs, and I want to thank and honour them for their work. The advice that I have is that all residents have been tested and all have been negative. There will be additional testing as the week goes on, but very importantly, all residents have been tested and all are negative. At this point, the advice that I have is that 4 staff of the cohort have been found to be positive, but it is likely that 2 are directly from the family involved, and the other 2 staff are also close family contacts, and so the working hypothesis is there's a very good chance that all of those who were infected outside of the facility. More work is being done, contact tracing is underway, research is being carried out. In particular, the workforce is holding up and is seeing a large number of offers of assistance. So the South Australian Aged Care Response Centre is working with SA Health. We're making sure that there's surge workforce available, but at this stage there's good clinical leadership, in fact excellent clinical leadership. There's also the support of the nursing team that came to Victoria to assist with the outbreaks here. They came from South Australia, and the 2 clinical leads of that nursing team are on the ground as we speak. In addition to that, full PPE is in use, and there's daily communications with family. We're also stepping up, and there are 10 further facilities that are being tested in the area around the Parafield outbreak, and all of those facilities will see testing of all staff and all residents. So at this stage, no signs of any additional community transmission. 3 cases on the advice of SA Health to the National Incident Centre of transmission within the cluster, and no signs of transmission to residents within Anglicare Brompton. But we are constantly monitoring, constantly focusing, and receiving updates. I know the Prime Minister spoke with Stephen Marshall again from the plane this morning, and he passed on that to me. So